How are patients typically responding to having their psychiatrist also being their therapist? Like, does that have any impact on retention or satisfaction? Is it different for people opening up? Is it easier? Is it more difficult? I'm curious.
That's a really good question. And there has actually been a fair amount of research on, quote, who's the best therapist. And the reality is that just having the MD after your name does not make you necessarily a better therapist than a master's level provider or a psychologist. The data has consistently found that your training has less to do with your skill as a therapist versus just your ability to build rapport with someone after a few sessions, which is actually good news because it means if you're building a good group practice or you're in a situation where you can't do the therapy, it doesn't mean that your patients necessarily suffer by having a different level medical professional as their therapist. I think the saddest thing for me is when people finish their training, and usually you complete a lot of therapy training when you're done with your fellowship for medicine. But then if you go to do a prescribing only job for a few years, a lot of psychiatrists get scared that they don't know how to do therapy anymore or feel like they wouldn't be a good therapist, and try to support and push people that, you can do it and you can read books and you just need to get your practice back. But I'm always sad when I hear psychiatrists are scared to do therapy because they've been out of the game for a while or something like that. But definitely your degree and training by itself tends to not have an impact on patient outcomes as a therapist.
Thinking about whether it's not necessarily a dual relationship, because that is kind of like a specific term that is reserved for something very specific. Though in this case, thinking of like, this is my therapist and my psychiatrist, I was kind of wondering if there was maybe any impact there. But it sounds like, kind of as you put it, it's really not that kind of a black and white thing. It really does seem to be more of like a person-to-person rapport kind of thing. It's not this like line in the sand that's like therapist over here, psychiatrist over here. It's really just, the one person who's providing your mental health care.
Right. And I would say, the one thing that I feel like the field of mental health treatment is getting better at, but there for a long time, and this went with sort of the stigma around mental health also somewhat, that it was sort of what goes on behind the secret closed door of the therapist office needs to stay secret. And I think that we have more of a responsibility to our patients that we're embarking on with therapy to say, here's the type of therapy we're doing. Here's how many sessions it's going to be. Here's the specific stuff we're going to work in therapy. Because we do see lots of times where people come in and are doing very poorly, and then you're surprised to hear they've been in therapy for 4 years, and you're like, well, what's going on? You're sort of wondering what's going on in the therapy, because we know that there are specific types of therapies and you need to pick the right therapy for your patient, and you should be tracking and seeing improvement. It's another thing we're trying to make easier in Ripsy, as you know, to like quickly see how your patients are doing. And it shouldn't just be come in and talk for 45 minutes with a friend. Like, this is a professional relationship. You have an obligation to engage in that therapeutic process and help your patients get better. Yeah. So that is for anyone who does therapy. I'd like to see that shift continue, that we're being more open about what's happening in therapy. It's not a secret. Here's the goals we set, etc.